So tell me where you're from.
I'm from Shreveport, Louisiana.
So we met about, 3-4 days ago. What's happened?
A lot. Face is relaxed, a lot less tension throughout my jaw, my temporal area. Face is a lot more relaxed.
So what was your problem when you came in initially? What was going on?
Tightness throughout my face, my neck, fullness in my ear, fullness here underneath the jaw. And for the most part, I mean, it's all reduced by 50% at least.
So what did we do? We did the screening, right?
Mm-hmm.
MRI, CT, we looked at TMJ stuff, looked at bite stuff, muscle stuff. You understood as we explained as we went, right? You guys got it? What'd that do for you? What did it make you understand?
That my neck has a lot to do with what's going on.
Yeah, right. So then we hit you with the neck blocks where we did the Greater Auricular Nerve and the Transverse Cervical. That made a big difference, didn't it?
Yeah.
Now we did it twice. So how do you feel today? Because we haven't done anything today.
Still improved. I mean, a little bit of tightness back here in the back of the neck, but nowhere near what it was.
Got it. So we also did your bite stuff. We adjusted your bite with the computer data.
Yeah.
We can't make it perfect because of the way your teeth are aligned. You know, that's an orthodontic problem. But how do you feel? What percentage better are you now compared to when you walked in?
I mean, I would say 50% at least.
Yeah.
Maybe more.
You look kind of normal.
Yeah.
Yeah. I mean, you were pretty wired when I first met you.
Yeah.
Yeah, you look relaxed. So are you glad you had it done?
Oh, yeah, for sure.
Give me a swish. Ice water.
That's reduced by at least 50%.
So when I first met you, back at the beginning of the week, you were swishing like an 8 out of 10, right?
Yeah.
Unusually, it was on your front teeth,
Mm-hmm.
not your back.
Mm-mm.
So after all the neck blocks and the bite stuff, the neck blocks reduced it by about half, right?
Yeah.
And then then it came back after that wore off, and then we did your bite, and now it's reduced it even more, correct?
Yeah.
The bite thing should be lasting. Your cold reduction, which is called an allodynia, a pain that's disproportionate to the inciting event, that should improve because we did something through the bite to the autonomics, the sympathetic and the trigeminal. Making sense?
Yeah.
So we had trigeminal, cervical, and sympathetic, right? That's the big deal. So, all right. So how about your neck in general? Is it better?
Yeah. Right side's still tighter than the left side, but
Yeah.
it's drastically reduced from what it was when I walked in.
Yeah. I want you to see the ENT for
Yeah.
that stuff that we saw in the MRI. Okay. All right, man. Thank you very much.
Cool.
What's going on with it?
Ear fullness, muscle fatigue in the right side of my face, and fullness feeling here up underneath my jaw too. Hard to turn my neck sometimes.
Yeah. How long has it been going on?
5 years.
5 years. What's been helping? Nothing?
Nothing.
And you saw the ENT, you saw the neurologist, they've eliminated ear organic problems, brain problems, things like that.
Yeah.
Your primary care, your MD, no idea?
No idea.
Orthodontist wanted to move your teeth around with braces.
Mm-hmm.
Oral surgeon wanted to take out your wisdom tooth.
Yeah.
But they didn't really tell you why. That was just their plan.
Yeah.
Ice water, what's it doing? 0 to 10.
Seven or eight, yeah.
Whereabouts?
Front.
Front, nothing in the back.
Nothing in the back.
There it goes. That's the worst, is it? You all right?
Yeah.
What's it feel like?
Definitely less sensation in the SCM area.
So the pain
Yeah.
is different. How about the ear? The fullness, the tension, whatever.
Less.
Is it less? So you said you were about a 7 or 8 out of 10?
Mm-hmm.
5 minutes ago, right? What are you now?
Probably like a 3.
3-ish?
Yeah.
Okay. Is it still the same?
Yeah.
The cold's exactly the same.
Yeah.
Up front, nothing in the back.
Nothing in the back.
No change in the cold.
No. Not nearly as tight.
Okay, that's good.
Easier.
What's the pain like? In the ear?
Probably like 2, Maybe down a little bit from what it was a second ago.
It's 2.5, somewhere in there.
Yeah.
So we've injected both sides now.
Yeah.
You were down to a 3 when you injected the right, now you're down to a 2.5 or so with the adding the left, so not much of a change. Switch that. Is it still bad in the front?
Mm-hmm.
The back, no big deal? So
Back,
this
no big
didn't
deal.
change at all? That's
No.
where. Okay. So we just injected the Greater Auricular. So now we're going to go to the transverse cervical and see if those lower front teeth change. Alright. Alright.
Mm-hmm.
Not fun, but shouldn't be terrible. This comes from C2, C3. Ventral, if I remember right. Which means front side of the spine. More inside is to, like, remember? Trigeminal, cervical, sympathetic, right? So sympathetics hitchhike on the GAN, the greater auricular, this guy, mostly the posterior, especially lower molars. Transverse cervical, conversely, is going to be more sympathetic. It's like a road for the sympathetics to hitchhike to the front. Because of that cold sensitivity, because there's no good reason for you to have cold sensitivity like that. There's not a normal dentist would say you're nuts.
Mm-hmm.
If you were coming in, that was your chief complaint, he'd be like, I don't know what to do for you. He wouldn't know what to do for him. He'd have no concept of what it could be. So try now. When Shih Tzus go
Oh,
wild.
they about to get somebody.
Way better on top. Still pretty.
What's the way better on top?
From 7 what?
Probably like a 4 on top.
So about half.
Yeah.
Bottom's
Bottom's
still 8,
still 7 or 8.
but the top changed.
Yeah.
Wow.
Interesting. Okay, so does this feel a little bit numb down here?
Yeah.
Like
That made more of a difference than the other one did.
Well, yeah, I believe it.
Because most of my fullness does get held like in this area. And it kind of, the air in the ear thing's there all the time, but this one's the more annoying of the two.
Oh, really?
Yeah.
Okay, I didn't hear that earlier. So right now, is it as annoying as it was?
No.
That changed.
Yeah.
So one of those major highways is the GAN, Greater Auricular. A more minor one is that transverse cervical, which is what we just hit. Do it one last time.
Same.
Same.
Yeah.
So 0 to 10 your top, front.
I'd say 3.
0 to 10 your bottom, front. No change.
Yeah. 7 or 8. Yeah.
Okay. Thank you very much. What's the bite feel like?
Better.
Decent?
Yeah.
Okay.
Normalizing.
Now, okay, you had pain here.
Mm-hmm.
Tell
Yeah.
me again, what's it like?
Under there, it's probably a 1 at the most right now.
Which is like way unusual, correct?
Mm-hmm.
Your ear was jacked, right?
Yeah.
What's it now?
Nothing.
Nothing. Okay. Move your head left and right, kind of like back in the car crowd. Remember the other day you were like having trouble? Is that
Yeah.
easier?
A lot easier.
Okay. We don't have perfect in the bite, but it's better, okay? Like I said, give me one last swish. 0 to 10 that.
Four on bottom, 2 on top.
Okay. Compared to
Like an 8 all the way around when I
Top and
first started.
bottom.
Yeah.
yeah. Now, after we did the neck blocks yesterday, you went from an 8 down to about the same numbers, wasn't it?
Yeah.
But then unusually, so when you walked in today, when you switched that ice water, what was it then?
6 or 7.
So it was almost the 8 again, right?
Yeah.
And now all of a sudden it's almost cut in half, right?
Yeah.
So tomorrow, I bet you when you switch the water, it's still going to be a 4 and a 2. It should be. Maybe, within a point or so.
Yeah.
And I bet you a month from now it'll be same-ish. In other words, the neck block is more of a temporary, you guys get it, right? Because we
Yes.
increase blood flow, right? With the neck block. Because we ramp down sympathetic tone. In other words, too much sympathetic tone with blood vessels, right? reduce said sympathetic tone, you get the parasympathetic, you get the rest and digest. You got away from the bad guy, heart rate's going down, blood pressure's going down because your vessels dilate, right? So, what's your face feel like right now?
Relax.
Rest and digest.
Yeah.
Blood flow, right?
Yeah.
Get it? See? And that relaxation of the face, that's not normal, correct?
No.
Like,
Ever.
okay. Like you don't even remember last time, correct?
Yeah, no.
Okay. You see, that's why the trick with doing with this stuff is understanding when to stop. Because, like I said, the bite stuff's not perfect. And I'm still seeing the contralateral, the non-working muscle not working. It's still working a little bit heavy. But I have to also base it on these other things, right? It's so much better than it was. Not perfect, but I'm going to hack you if I make it perfect. I'm not going to do that. Deal?
Deal.
So, like it was?
It's like a 1 on top and like 3 on the bottom.
Oh, so it's gone down a little bit.
Yeah.
Damn, okay. Sweet. That's pretty cool. All right, let's do the neck blocks. I'm going to do them both at once. Let's get them over with. Right now, you feel really good, huh? Nothing to do, or?
Yeah, I feel relaxed. I don't know.
Yeah, you look pretty chill.
Yeah.
This way he's kind of slowly moving.
Yeah. Way different than normal.
Really? How so?
Hey, I don't know. He's just always.
Wired.
Yeah. Yes.
Fight or flight.
Yeah.
Fight or flight. Yeah. Okay, lean back for me. Oh, what? Thanks. Where's the poke? You alright?
Mm-hmm.
You got it, Chris?
Yeah.
Poke.
Celebrity.
Then I kind of know it here.
That feels different
Already, right? Alright, we nailed him. Just sit for a minute or two. See
Alright.
what happens. Okay, so today we did the bite stuff. Did it make a difference for you? Did it change anything?
Yeah. A lot more relaxed in my face and my neck.
That's the big thing, right?
Yeah.
Yeah, so if you twist left and right, it's easy now?
Yeah. Easier than it was for sure.
Yeah. And you look kind of sleepy, right? So we not only did the bite thing using the computers and the electromyography tracking the muscle, we also hit you with the neck blocks again. We want to ramp down the sympathetic tone. The cold thing, so yesterday we also did neck blocks. Your cold decreased after neck blocks yesterday, but it came back again overnight, right?
Mm-hmm.
So it was back to baseline again this morning when you walked in?
Yeah.
When you walked in and switched the ice water, it was about a 7 or 8?
Mm-hmm.
Top and bottom front teeth, correct?
Yeah.
What is it now? Let's see what it is now.
It's like a 3 on bottom, 1 on top.
Yeah. And it was like that after we did the bite stuff, right?
Mm-hmm.
So the bite adjustment changed your cold sensitivity.
Yeah.
And your face became more relaxed, right?
Yeah.
Your main problem was the right ear and the right underneath your jaw area, correct? Mm-hmm. And now it's
Don't feel it really at all.
pretty much gone.
Mm-hmm.
Okay. Let's see what happens tomorrow.
All right.
All right, man. Thank you.